Good morning everyone and welcome back. Today we're going to be talking about the non-steroidal anti-inflammatory drugs or NSAIDs, and we'll have a mnemonic to help us memorize everything. These are the NSAIDs drugs that you'll have to remember for your step 1. The mechanism of action is that they block cyclooxygenase 1 and 2, which will inhibit the synthesis of prostaglandin. NSAIDs are commonly used for back pain or muscle strain, so the mnemonic is the word strain. S for stomach ulcer, which is caused by the absence of prostaglandin, because normally prostaglandin will protect the gastric mucosa. T for transposition of great vessels, which is contraindicated with NSAIDs, because in transposition of great vessels we have a PDA or patent ductus arteriosus, which is required for life in a patient with transposition of great vessels. We keep PDAs open by prostaglandin and low oxygen in the blood, so when we use NSAIDs which will block prostaglandin, we will also block the PDA. So NSAIDs are contraindicated with most cyanotic heart diseases that require PDA. R for renal injury, which is due to ischemia and interstitial nephritis. Note that with NSAIDs, interstitial nephritis causes more damage than ischemia. A for antipyretic and analgesic effects of NSAIDs. I for indomethacin, which is the drug of choice to close PDA. And finally, N for narrowing of renal arterioles. The renal arterioles usually stay open by the prostaglandin released from the proximal ducts. So when you block prostaglandin by NSAIDs, you will also cause vasoconstriction of these arterioles, and thus causing ischemia of the kidneys. And here's a small quiz. So we know that NSAIDs can block cyclooxygenase 1 and 2, but one of these drugs can only block cyclooxygenase 2, so it's selective. Which one is it? The answer is Celecoxib, which is selective for cyclooxygenase 2. Aspirin, like NSAIDs, also blocks COX-1 and COX-2. Alright guys, that's everything I've got. Hopefully I made this easy for you. Thanks a ton for watching, and I'll see you guys later.